Women in Data Science Worldwide has been around since 2015. We started pretty small, as just one conference on Stanford campus, and our aim then was to simply feature outstanding women doing outstanding work in data science. And then we grew. We grew into a global movement, connecting women and also men around the world.
WIDS has grown organically, responding to what the needs of the community are, what women data scientists need, and exploring new ways to interact. Stanford University is proud to have been the birthplace of WIDS and a decade of growth. With our unique strength in data science, computation, and AI, Stanford was the ideal incubator to support this force for advancing diversity in data science. WIDS has had a lasting impact on data science at Stanford, with a co-founder of WIDS as a founding member of Stanford Data Science. Including multiple perspectives is baked into the core identity of our programs.
It's critical, and we need women in these roles. Every individual brings their own perspective, and so we need to make sure the entire workforce is represented.
Because it really fosters that sort of community building you want when it comes to not just data science, but really any, I think, efforts to try and engage more girls and women.
So the fairness mission that we have is really try to enable that two people with equal talent should have an equal shot at opportunities.
I also just encourage people not to give up and keep arguing for what you believe in and what's important to you and what you think will make a difference.
WIDS is about the sense of urgency we should all feel to ensure that women earn that seat at the table based on their skills and talent across the world.
WIDS has inspired me to believe that more is always possible.
WIDS has inspired me to think big. WIDS has inspired me to learn more.
It brings together some of the leading scientists in the world.
The journey is just beginning. At WIDS, we're not just envisioning a more inclusive future in data science and AI, we're making it happen. From equipping students with critical skills to advancing career development, we're expanding access to education, mentorship, and empowering support for tangible impact. The next decade starts now, with action, with us. Join us in shaping the future. Volunteer, mentor, or donate today.
Assalamu alaikum, everyone. With you today is Dr. Hana Turki. I am an associate professor in computer science department at University of at Prince Hattab University. I will be talking with you today about how big data and AI are revolutionizing the healthcare system for the future. Our outline will start talking about the journey that AI and big data are taking healthcare from a reactive care system into a proactive health management. Big data considered to be the heartbeat of today and tomorrow healthcare and medicine and personalized medicine. Artificial intelligence is the pulse that can see what is unseen or what is the human can't see from the big data, the health data, and provide solutions and treatment plans for the patient. Together, they transform healthcare into a proactive healthcare or AI-powered proactive healthcare system. The old paradigm for healthcare was mainly focused into a reactive system that designed to repair a broken health for the patient rather than preserving or optimizing the patient health or predicting and preventing any health issues. And most of the old paradigm was fighting the disease into using a limited information, using what is known to be a one-size-fits-all system. In this old paradigm, we fight the data with, like we are fighting the disease what we are fighting the disease into the dark with a limited data, because most of the healthcare system was mainly focused into caring for the patient after the symptoms are triggered. The disease triggers some of the symptoms, and the patient sought help. So the healthcare system started to treatment for the patient. Most of this system was mainly a treatment plan, either a surgery or a medicine treatment plan based on designing a treatment and medicine that is designed for the average patient, ignoring the individual differences between the patient, ignoring the genetic blueprint for the patient, the lifestyle, the environment, and so on. So the main challenge that facing this current old paradigm for healthcare is this approach missed most of the early warning or early detection for the disease, and that's why it is a struggle with a complex chronic disease and sometimes ineffective treatment and side effect and so on. The current development in big data and AI proposed a new system. This system, they call it AI-powered proactive healthcare system. Let us first show a comparison between the reactive model, the current reactive model, which is known as a sick care model, and the proactive healthcare model, which is a complete system for health management. For the reactive model, its main focus is on treating illness after it is already occurred. That's why it is mostly expensive for the patient and uses a lot of resources like emergency rooms, hospital stay, advanced treatment for a late-stage disease, and so on. The patient role in this system was mostly passive. They just feel some symptoms, they seek treatment and receive the care until the symptom disappear or until the disease itself is cured. These issues was leading to, or this system was leading to some issues like most of the patient or some of the patient will be readmission into the hospital, a high rate of mortality, and a high cost for the procedure of the care of the health care itself, which result in what we called apathetic care, which less effective for the cost and take a constant cycle of treatment for the symptoms rather than searching for the root cause of the disease. While as for the proposed or the current trend in healthcare, which is a proactive healthcare model, this proactive healthcare and health management model are focused into providing a system that prevent illness rather than treatment, or rather than just treatment for the patient, and also focus in maintaining an optimal well-being for most of the patient or for the human as a general. This could lead in the long run to invest in preventing disease, invest into a well-being program, early detection of disease, life support system, and so on. The patient role in this model will be an active role. The patient will be participating in their own health through engaging in prevention, measurement, and adjustment for lifestyle. And this system will increase the quality of life and increase the well-being for the population. And the resulting is a continuous health management system, improving the quality of life and sustaining a healthy lifestyle for the population. how can we arrive or reach this proactive health management system? The core of this health management, this new health management system, is the big data and the AI, artificial intelligence. For the big data revolution now is a significant shift derived from the massive continuous generation of data. For healthcare, big data considered to be the heartbeat. Because if we look into most of the huge data set or data stored into a system online, we will find that more than 13% of the generated data volumes are healthcare data, starting from the genetic data, going through a different data set, arriving to wearable device generated data set that everyone using nowadays. So what makes the big data the heart for the future healthcare system? Big data are collected from big data could be collected excuse me. Oh, yes. Is the control? Yeah, I got the control for the data. Yeah, this. Like we said, the proactive healthcare system will mainly focus into management systems that maintain the well-being health and preventing the health and preventing diseases or epidemics and so on. Okay, big data considered to be the heartbeat for healthcare because, as I said, around 30% of the data generated nowadays is generated from the healthcare. This data started with a clinical data set, like data stored into the healthcare record, the lab result, the doctor notes, or genetic data set like a full DNA sequencing or protein sequencing for different individuals, the genetic blueprint for the individuals, the imaging data, which is widely used in most of the diagnosis and diagnosis of most of the disease, like CT, X-ray, MRI images, and so on. Nowadays, also with the current technology, we found that there is a lot of tracking wearable devices and application that track the human vital sign, like in the fitness tracking, the smartwatch, and some of the apps. All this data could be collected and used into the used for the future healthcare proactive model. Data also that could be collected for research, like the clinical trials data, the publications, medical publication, and so on. So how big data fuels the smart healthcare system? Big data there is a constant flow of big data, which is essential for any AI model to work efficiently. This big data could be used into a precision and prediction modules that moved from the one-size-fits-all, which is mainly focusing onto proposing a treatment and medicine that is used for the average person and then try to apply it to different person. We could use big data to move from this one-size-fits-all model into a personalized treatment plan and personalized, measured and invented medicine for some of the person. We can also use this big data to identify the population level of health and trade and predict the disease outbreak. We can also use this big data to propose efficient and discover new drugs. And also we can use it to optimize the hospital operation to reduce the wait time and reduce the cost for the treatment plans. Where big data considered to be the heartbeat for the new or the proactive healthcare system, artificial intelligence is considered the pulse for the healthcare system. Artificial intelligence can identify patterns that human can't see. And it could be applied to a huge data set that human mind can't process at the same time. So how is the AI will move from the reactive healthcare model into a proactive healthcare model is that the AI is working now as the engine that makes sense of what is the data mean and use this data to enable a personalized healthcare ecosystem, which is shifting from treating illness after it occurs into predicting and preventing illness. AI can predict the unpredictable. How AI is doing this? AI can intervene by using AI to intervene before a crisis happen, during an operation or a crisis happen for the patient at intensive care unit stay. Also could be used in early detection and warning system, which can monitor the vital sign for the patient 24/7, help clinical system to alert or help the clinical system to alert the staff when there is an abnormal symptoms or any significant changes in the patient state. It could also use to detect some of the silent diseases, like for instance, what is known to be the heart silent disease. AI, there is an AI model that already using the ECG signal and deep learning to detect some of the silent diseases like atrial fibrillation with an accuracy that reaches more than 80% accuracy, even when the heart rhythm is still within the normal range. They can detect any of these diseases. AI also will work as a second pair of eye. AI will augment the human experience. For instance, AI could be used during radiology treatment by using an algorithm that can scan thousands of images within a few minutes and flag any abnormality, and use this model during radiology process while the doctor can't scan or can't keep track of all the images. The AI can keep track, point the abnormality, and then he can give a recommendation for the doctor. So AI will be giving a huge boost for the doctor and radiologist in order to process this data. AI also could be used in recent detection of different diseases, like AI detector for cancer from some of radiology and monogram scan. AI could also be a real-time assistant for the radiologist during the coloscopy, where AI will be detecting and overlaying the highlights for some of the props or some of the changes that are in a video scan of some of the patient, and then point out this props or these changes in order for the doctor not to miss any of the symptoms that exist. And it will be a great help because It will be working into a frame every microsecond or every millisecond, so it will be more accurate than just seeing with the eye of the doctor. AI also are using in drug discovery, and it gives an acceleration hope for the drug discovery, because in the traditional drug discovery system, most of the drug taking around 10 years and billions of dollars in order to develop a new drug in a traditional way. Whereas if we used AI, we can improve this time-consuming process by reducing it to around 1 or 2 years to develop the new drug. And also AI can reduce the cost for most of the drug experiments. Developing a new drug for the next generation healthcare proactive model are mainly focused into a precision medicine. Precision medicine is a new domain of research now, and there is also some of the applied module for some of the tools that I will talk about later. In precision medicine, treatment approach are designed for individual patient based on this patient genes and environment and lifestyle and clinical data. So how AI will be a great help in precision medicine? First, AI will be using a genetic AI analysis system in order to scan a complete genetic profile for the patient to identify any specific cell abnormality or DNA mutation, which guide the doctor or the therapist for the targeted surveys for this patient or treatment for this patient that will be more effective than just a general survey for the patient. AI also, as a technology, could be used for building a digital twins. Digital twins is a virtual AI system that simulates a physical system. So if we use it, digital twins into the healthcare system, digital twins will be working for creating a virtual AI model that can simulate the patient origins and the patient clinical state and the patient DNA and cell. With all this detailed simulation, the doctor can also use this digital twin to simulate a treatment or a surgery digitally and see how the result of this treatment is going, what is the side effect. All of this will be done as a simulation before applying it or before touching the physical patient himself. So the doctor can use a different treatment and then compare between them, and at the end pick the treatment that more suitable for this patient. Also, AI could be used for post-treatment after the surgery or after a treatment plan. It could be used to predict and analyze the relapse risk of any of the disease, especially for the cancer disease, because there is always a high chance of relapse for some of the cancers. So using AI to predict the relapse chances or risk for the patient, use AI also to enable a continuous monitoring for the patient and providing a post-treatment assessment after a surgery or after a treatment with a medicine. In a field of diagnosis, AI have been used into many research and most of this research focus into using, for instance, medical image analysis, like using X-ray image or CT image, and detect some of the diseases, not only disease, detect also a microfraction for the sports, for instance, detect early stages of some of the cancer tumors. That most of these early stages will be could be missed by the humans. So using AI and deep learning to analyze this medical images will be more helpful than just look by the eye for the doctor. AI also can be used as a predictive analysis. It can be used to predict what is the next stage for treatment, what is the next stage for disease, analyze the patient vitality in real world, and predict what is the critical event that may happen during the next 24-hour or 48 hours, and so on. It could use also genomic profile to process, and this genomic profile, like the DNA profiles, are a huge data set that is available online. We can use it. So mostly, like we see in the figure displayed, that the AI system can mainly use either imaging data, like pathology data or radiology data, or use a non-imaging data like a lab test dataset, clinical report, lifestyle factors, and so on, and collect it into a clinical decision support system in order to reach a specific treatment plan personalized for each patient separately. There is a many real world already system already are proposed, invented, and available online that you can look at and try some of them. These four systems are example of the already real world AI-based proactive system. First of them is the AI Doc. AI Doc is a AI tool that uses radiology imaging and deep learning in order to scan a medical image. Its focus is mainly for the CT images of the brain to detect any critical or time-sensitive condition of the patient, like hemorrhage or embolism for the brain, brain tumor, and so on. And this application, there is a website called AI Doc, and you can find already this application and use it. Another application is Bath AI. Bath AI is a digital pathology diagnosis system that mainly used deep learning to analyze the pathology scans or pathology slides with a high accuracy. And Bath AI is mainly focused to detecting cancer disease and diagnoses the level of or the stage of the disease. Another application that also use medical imaging is the Cure AI. Cure AI is already free to use application that you can that already used an AI model trained into the CT and X-ray images with a high accuracy for diagnosis disease like lung disease and heart stroke. And you can already use it online if you open the site cure.ai, and you can upload any CT image and he will give you an initial diagnosis from the image. Another application or tool called Timbus. Timbus is a precision medicine tool that uses genetic analysis It gathered genetic and clinical data and analyze it in order to help the doctor to create a personalized treatment plan. And it is particularly focused into oncology and rare diseases. If you search for diagnostic AI tool online, you can find other different tools, but these tools are mainly the tool that is famous and trustworthy to use it. AI also is used now in operation room, in surgery. There is a lot of robotics helper, which is AI guided, that can assist surgeon with their precision and movement stability to minimize any risk during any operation. And this tool could be, or this robotic could be a fully automated AI robotics, which is considered to be still not very famous operations nowadays, but the famous AI tool are assisted and helping AI tool. It uses a robotic that is guided with a cooperation between the AI for high precision and the surgeon or the doctor themselves in order to perform operation. AI also could be used as a virtual assistant for the patient even before starting the process of treatment. Like there is a lot of chatbot, intelligent chatbot that use AI. Patient can ask a question and then it can point out some of the symptoms, and then the chatbot, the intelligent chatbot, will be helping them into like focusing on which direction he should go on with his treatment seeking or clinical, choose the best clinic that he could seek for his treatment and so on. Some of these tools are already built in, like ADA. ADA is a famous tool for symptom checker. It's called AI symptom checker. ADA AI symptom checker. It's a chatbot that mainly focus into asking some of the question for the patient, letting the patient point out some of the symptoms, and then use AI in order to provide a self-service initial diagnosis support, and also a guide toward the appropriate care, like which patient or which clinic he should be visiting, and then which first initial care he could do for himself before seeking a professional health care. IBM also built a chatbot that mainly based on natural language processing and deep learning. It analyzes some of the unstructured data provided. This unstructured data like health record, doctor notes, and so on, in order to make a recommendation for personal treatment, make a recommendation for diagnosis and the level of diagnosis, and so on. This tool is called IBM Weston Health. Some of the hardware-oriented tools that is used into a surgery and used also into diagnosis, like a tool is a robot assisting surgery called Mako system. This Mako system is a robot that assigned surgery platform. It's a robot assist surgery platform that can help surgeon perform a joint replacement surgery, which is for something like the hip or the knee, which is very accurate or a surgery that need very high accuracy, because if anything went wrong during a joint surgery for the hip or the knee, it could lead to a lifetime disability. So using AI and robot assisting AI can help with enhancing the precision and guidance for the doctor. There's also a tool that called Butterfly Network with the 2 versions, IQ and IQ3 version. It is actually an ultrasound scan using your mobile. It is a design handheld AI-powered ultrasound probe using your mobile or connected to your mobile, and allows health provider or even the normal people to conduct a high-level ultrasound with different setting. And you can use this ultrasound later for diagnosis or for tracking of the patient and so on. These are some of the real-world applications that used AI for healthcare. Healthcare, using AI also for healthcare will restore the human touch for care. We know now that most of the doctors are always busy and always burned out from the massive workload that they are facing. And it is also recorded into one of the surveys that each doctor will spend around 2 hours of documentation for every 1 hour of patient. So he's using more time into a documentation than actually into interaction with the patient, talk with him, look into the patient eye, and give him some assurance during the treatment and so on. So AI could be used, and also there is a real-world application that used AI. I will talk about it, but how AI can be used to help this humanity touch between the doctor and the patient. AI could be used in different way to help the doctor, but it also could be used to reduce this massive workload of documentation the doctor can do by, for instance, taking a real-time notes and organizing it into a structured clinical data, transcript some of the notes, some of the conversation between the patient and doctor in real time, and document it into a structured data that could be used later also as a record for the patient and so on. And there is one of the real world application, cashier permanent healthcare system, that already used, it's a complete integrated healthcare system that already used this idea of AI real-time documentation, storing and structuring of the doctor notes, doctor conversations, and interaction and symptoms for the patient. And they discovered that using the system can save around 15,000 hours yearly for the doctor, which allows the doctor to be more in touch with the patients than just using most of his time in writing documentation about the patient's state. AI proactive healthcare system will go beyond the hospital wall because the future healthcare system will be not just making a better hospital, but making the healthcare system itself follow the patient home with using IoT wearable devices, remote monitoring in order to track the patient status out of the room or out of his ICT, for instance, and also maybe out during his walk or during his normal activity. He can track. The system can track the patient in this way. So it will provide a continuous care, like monitoring the diabetes, glucose, and cardiac rhythm for the tracking in the background and so on. And this system will make AI not only monitor, but also it will use some of the algorithms to anomaly detect and make alerts for the staff and the doctor if there is any abnormality happen during the patient normal activity or normal life. Using AI in predicting disease and helping the patient and helping the doctor into providing new plan will also lead to some factors that us as a computer scientist should be concerned about, which is a critical factor for the success of AI-powered healthcare. These mainly three factors are the data privacy factor, the bias and fairness of the data and the AI module, and also the natural black box structure of the AI itself. Let us start with data privacy. There is a massive amount of data, could be clinical data, imaging data, genetic data, and so on. And these data are data for real life patients. So in order to make better use of this data and enhance collecting more massive data in order to enhance the AI module, we needed to ensure that there is a level of privacy for this data to protect the patient record and from any breaches or any security risk and so on. So this privacy for the data is a main factor for us as a data scientist to work on. The other factor is the bias and fairness of the module. We know that AI mainly focus whether this AI module could be a machine learning, ensemble learning, or deep learning modules, or generative AI, and so on. All of these modules are main focus into using or learning from historical data or learning from record. So if the data itself is biased during your training for the AI module, then the AI module also will be biased. For instance, if you are training for prediction of disease, cancer disease, for instance, into a data that is already collected from a patient that live in Europe, for instance, and you are training a module into this data, and then you want to use this module in the Middle East, for instance. The data will be biased because some of the diseases, especially like cancer disease, are environment effective. So if you needed to make an unbiased and fair module, you needed to train it into a local or same environment dataset collected from a patient for the same environment that you are going to apply your module on. So we needed to take care of this fairness and bias for the algorithm to ensure the equality of the demographic data during the training for the module, if you need it to be a public module. The other point is the black box natural of the AI. AI is a black box because most of the advanced AI technology now, or AI algorithms like deep learning, for instance, the AI module predicts the outcome. Okay, he didn't tell you how he arrived to this outcome, or why he arrived, or why he picked this outcome. We as a computer scientist, we can accept this because we know how deep learning work, how neural networks work, and different module, how it is work, but other domain, people working in other domain like clinicians and patients, they don't know this. So how can we make them trust our AI module? And this is currently a huge research domain, which is mainly focused into what is called now explainable AI, XAI. XAI is an AI module itself that try to tell or try to explain why your AI module arrived to a specific outcome. So he give you the reasons, the reasoning about your prediction, for instance, the reasoning about your detection for a specific disease and so on, which will make AI and deep learning more trustworthy and will give the clinician and patient a more trusted recommendation than just using AI alone as a black box. AI will not, or the proactive module will not replace doctor. It will be a partnership between the AI and the doctor in order to provide a healthcare that is more precise, more efficient, and more humanly than ever before. As a conclusion, we can say that the future of healthcare is mostly data-driven. AI will be the engine that learn and reason, and big data will be the fuel that powers this reasoning. And together they are creating a shift from, they will create a shift from the reactive traditional modules for healthcare into a proactive, predictive, and preventive personalized medicine healthcare guided system. But this transition from the reactive into a proactive system will give us a lot of promise, and it will also give us a lot of challenge to address. First, the proactive care will promise the patient with more accurate diagnosis, a personalized treatment plan and personalized medicine, a smart health management system, and so on. It will also provide the healthcare provider with enhanced decision support, increase the operational efficiency, reduce the administrative burden, and other advantage. Also, it will help researchers to drastically accelerate their discovery for new drug and new therapies. But it also will have a lot of a challenge or a required responsibility for innovation thinking to address this challenge. Some of these challenges that we needed to address is the data privacy, the algorithmic bias, the regulatory framework to build a trust for our AI system. Also, a challenge or responsibility of keeping the human element the main focus or the main center of healthcare, because human element provide a powerful powerful humanly treatment for the patient and a more trustworthy interactions for the patient. This is all for how AI and big data will affect or will enhance the healthcare system. And if there is any question, I will be gladly answering it. If there is any question, I can take it. You can write your question, for instance, into the comments or send it into the private chat. Okay, there is a question, which is the best big data format for healthcare? Healthcare data have a different form. So which format is the best? It is based on what is your data is. For instance, if it is an imaging data, there is a recording for this imaging data will be a frames for the patient. For instance, if you have a CT images in different time frames, or if you brought it into a formatted images, because when you are going to use it into a deep learning module, you are using it as images with a pixel and read it into the deep learning module with any types, CNN modules, generative AI, transformer, and so on. So you will be leaving it as an images and then use it. If it is a clinical data, the best format is using the what is called electronic health report, HCR, which is used currently in collecting data in different format. It collects data into a text, like using the like collecting the doctor notes, and then collecting also some of the tests like blood test or urine test, in any medical tests and the result. So there is a specific standard format for this clinical data. It's called electronic health record. Other format, like using genetic mutation, it will be a sequencing, text sequencing mutation, and so on. Okay. Any other question? Okay, there is no other question. Thank you for your listening. I hope you have gotten more knowledge about healthcare or new healthcare proactive system. Thank you, everyone.